So can you go to the dentist to have a root canal done and leave with permanent nerve damage? Hi, my name is Charles Buist, and I'm a dental malpractice lawyer. And today we're going to be discussing a common dental procedure that many of us have undergone, or at least heard about. I'm talking about the root canal. But more specifically, we're going to focus on how these procedures can go horribly wrong and cause a patient to suffer permanent nerve damage. So let's get right into it. A root canal is a common dental procedure intended to save a tooth that cannot be preserved with a filling or a crown. The goal is to save the natural tooth because losing a natural tooth is horrible. And while there are some substitutes, like dental implants, they require more maintenance than a natural tooth, just like any other prosthetic. And just like any other prosthetic, like a prosthetic arm, eye, or finger, a dental implant is not part of your body, and there's nothing better than the real thing. The process of a root canal involves removing the pulp inside of the tooth, disinfecting the inside of the canal, and then filling that canal with a rubbery material called gutta-percha. This procedure requires precision and care, and if the dentist messes up, it can lead to infection, and in more extreme cases, it can lead to permanent nerve damage. This is especially true when we're dealing with teeth on the lower jaw, because the inferior alveolar nerve runs right through the middle of the lower jaw, just millimeters away from the root tips of the lower teeth. Now let's talk about the different kinds of nerve damage symptoms a person might experience after a botched dental procedure. Symptoms of nerve damage can vary from a loss of feeling and numbness to tingling, burning, or other weird sensations. When someone suffers nerve damage to the inferior alveolar nerve, that person may experience extreme pain and numbness in the areas around the chin, jaw, lower teeth, and lip. On the other hand, if the dentist severely injures the lingual nerve, the patient may experience numbness and other sensations on the left or right side of the tongue. So what can cause nerve damage during a root canal procedure? After all, this is a routine dental procedure, so how can it go so horribly wrong? Well, there's a couple of possibilities. First, let's talk about root canal overfill. This is where the dentist overfills the canal with gutta-percha. On the lower molars, the root tip is very close to the inferior alveolar nerve canal, like we talked about. And when the dentist overfills the root, the material, the gutta-percha, can extend beyond the apex or tip of the root. And if enough material is pushed through the apex of the root, it can end up in the inferior alveolar nerve canal. And this can cause severe nerve damage. It can also require surgery, not only to repair the nerve, but also to remove the material from the nerve canal. Root canal overfill is not the only way a dentist or endodontist can cause permanent nerve damage during a root canal procedure. Another cause of this type of injury is where the dentist extends the root canal file through the root and past the root tip and into the nerve canal below. In more extreme cases, the file may even break off, leaving a portion of the file sticking out from the tip of the root and into the nerve canal. As you may have guessed, this can cause the patient to experience unbelievable pain, and it can lead to very serious complications. Again, because the inferior alveolar nerve runs through the middle of the lower jaw, damage to this nerve is really only possible where the root canal is performed on a lower tooth. If you suspect that you've suffered nerve damage following a root canal procedure, you may be wondering how this type of nerve damage is treated. Well, the response varies depending on the nature and severity of the damage. In the more extreme cases, like we've talked about, the patient will need to undergo surgery to remove the section of the nerve that the dentist destroyed. And it may require the patient to have that section of the nerve replaced with a graft. Now, The reality is that these procedures are not always successful. And even after undergoing nerve surgery, the patient may have to live with nerve damage symptoms for the rest of his or her life. In fact, this is not uncommon at all. Well, that's all I have for you today. If you've suffered serious nerve injury after a root canal procedure, you may be entitled to compensation. Please don't hesitate to give us a call. We offer free legal consultations, and we handle dental nerve injury cases across Florida, Georgia, South Carolina, and North Carolina. All you have to do to schedule a consultation with us is call the number below in the video description, or you can visit our dental malpractice page at www.carelessdentist.com. Thank you so much for watching this video, and we'll see you next time.